Assalamu alaikum. Myself, Muhammad Ali Murtaza. The topic that has been assigned to me is ovarian remnant syndrome in a cat with ovarian tissue in the omentum. So basically, when we start with the key points, it's basically a species of a 2-year-old spay cat that is domestically short-haired that was presented with the reoccurring estrus behavior after the ovariohysterectomy. It previously went to successfully exploratory laparotomies, and the case was highlighted to show ectopic location of ovarian ectopic reasons. So the history and clinical signs that we observed were that it was spayed after the 15 months, before the 15 months at the shelter. Astro signs that it shows for 5 to 6 weeks were of three kinds: rolling, number one; number two, vocalization; number three, vulval licking. First exploratory sample was taken, ovarian tissue removed at the left pedicel, no histology was observed. Second exploratory was taken from tissue removed near the right kidney, no histology was observed. Signs persisted post-surgically. Diagnostic evaluations. The steps we took for the physical and laboratory findings were physical exam that appears to be normal. Then we took PCV, TS, BUN, glucose that were over the normal limits. Hormonal tests, these were the most important things. In this, we observed the two hormones that were AMH that proved to be positive, confirms that there was an ovarian tissue present over there. Then progesterone, that was of the value 6.76 nanogram per ml, consistent with the luteal activity. Then comes the ultrasound, the most important thing, that showed hyperechoic amorphous tissue caudal to the left kidney. That basically differentiates scar tissue versus the ovarian remnant, as it is shown over the picture. Then comes the surgical exploration, the intraoperative findings. Ovarian pedicels and uterine stump, they were appeared to be grossly normal. Then comes the two small omental nodules that was identified according to these three dimensions, and they was proved to be normal. The surgical procedure that we used was midline approach, electrosurgical excision, routine abdominal closure, and uneven full recovery that was shown as it is predicted over the picture. Histopathological results were seen, and it was divided into two forms: pedicel samples that shows the fibroadipose tissues, no ovarian tissues, and then minor hemorrhages and scars were seen on the tissues. Then comes the omental nodules. One nodule was showing ovarian remnant that showed the two things: secondary follicles and Graafian follicles. Then the third thing, the most important thing, was no corporal lutea was observed. Likely it was shown that it was likely to be regressed. The conclusion we adopted from this was true ectopic ovarian tissue abandoned in the omentum. First reported feline case not associated with the ovarian tissue. That means that this case was not presented uh, in felines before. Outcomes and follow-up. Those was post-operative status. Estrus signs resolved completely. Means that cat doesn't show the estrus signs again. The follow-up was done 28 weeks. That shows the two hormones that was more important, AMH, that was negative, and progesterone was 0.06 nanogram per ml, confirms the complete removal of functional ovarian tissues. Owner report was seen 25 weeks and no occurrence of the estrus behaviors was seen. Discussion and clinical lessons told us that ORS, ovarian remnant syndrome, commonly results from residual tissue at the pedicel, not in this case. Ovarian tissue can revascularize even when freely floating into the abdomen always. 3 points were seen: perform complete abdominal exploration, submit all excised tissue for histopathology, consider AMH plus progesterone for diagnosis. Clinical importance, we need the awareness of ectopic ovarian tissue crucial, and then ensure accurate diagnosis. This is the most important thing. And successful treatments are always seen. Thank you.